Headphones on?
Welcome, everyone. Welcome to our next podcast. My name is Craig Spencer. I'm the audiology team lead on the Widex side, and we're excited to welcome you to our discussion today, focusing on effective management strategies for patients dealing with bothersome tinnitus. And to help us navigate this really critical aspect of hearing care, I'm joined again by Dany Pineault, a highly experienced clinician with over 25 years of experience managing patients with problematic tinnitus. Dany serves as the Adjunct Professor at ATSU University's Arizona School of Health Sciences, focusing on tinnitus, hyperacusis evaluation and management. And you'll obviously recognize him from the last few episodes that we've had. So welcome back, Dany.
Thanks, Greg. It's great to be back on the podcast and contributing to these educational talks on tinnitus as they're needed.
Absolutely. Couldn't agree more.
By the way, your emphasis on managing tinnitus is right on target today. It is a fundamental component of hearing care.
Now, since we've broadened our understanding of tinnitus assessment strategies in our past episodes, let's move on and start to talk about how to manage tinnitus with tinnitus patients.
So as hearing care professionals, we have a range of clinical tools at our disposal to assist patients who are struggling with bothersome tinnitus. So what do we have? We have counseling, amplification, sound therapy, sound enrichment strategies and devices, and sometimes informed or smart referrals to other health professionals to make sure our patients get the best care and support they need.
And I think it's important that clinicians incorporate all of those things effectively. You did mention counseling, though. Maybe we can get into that particular topic in more detail.
Absolutely. In my book, counseling is the magic ingredient we use in all our effort to support patients with distressing tinnitus. Now, counseling involves many different aspects, but one key component is the provision of comprehensive information to patients and their family, covering everything from test results and associated conditions such as hearing loss, difficulties understanding speech in noisy environments, reduced sound tolerance conditions such as hyperacusis, and emotional and behavioral disturbances such as sleeping problems or high level of stress. Counseling also involves debunking common myths and misconceptions surrounding tinnitus causes and treatments, and educating on the unique association between tinnitus and mental health, and especially the bidirectional or two-way relationship between the two conditions. The goal really is to empower patients and their family with knowledge, enabling them to make informed decisions regarding treatment options, and helping them reconsider the experience of tinnitus through a more positive lens. Now, in 2016, Az and colleagues conducted a survey of 93 individuals who received tinnitus and hyperacusis interventions in the UK National Health Service Audiology Department. It's a mouthful, right? Now, did you know that a vast majority of these individuals viewed counseling and education intervention as more effective than amplification and sound therapy in managing their conditions?
That is interesting, and I guess surprising in some ways, but also not.
Yeah.
We certainly recognize the importance of counseling, I think, in our industry in general, but yeah, that is interesting for sure. Now, when it comes to dispelling myths or misconceptions, can you talk a little bit about how you go about doing that with tinnitus patients?
Yeah, it's very common for patients to enter the clinic with preconceived notions, misconceptions, and sometimes just plain inaccurate information about tinnitus. As you know, some patients have been told by either their primary care physicians or their ear, nose, and throat specialists, or former hearing care professionals, or family members, friends, or complete stranger on the internet, that nothing can be done about tinnitus. While it's true that there's no current medical cure that can completely eliminate or suppress the perception of tinnitus, patients need to know that there are treatment options that can be quite effective at reducing its impact, at lessening its impact, and improving overall quality of life. So clinicians play a key role in making sure patients understand that tinnitus itself is not a disease, but is rather a symptom or a set of symptoms pointing to an underlying condition or conditions like, you want to guess?
Hearing loss.
Yep.
Hypertension.
Yeah.
Aging of the auditory system.
Yeah. Or exposure to loud noise and or music, as we discussed in episode 1 with young demographics in Canada. It's also imperative for clinicians to address patients' primary fears, worries or concern related to their tinnitus for the sake of their mental well-being. As we previously discussed, exploring the non-auditory components or mental health aspect often associated with bothersome tinnitus enables clinicians to initiate that process. Once again, the iceberg model as it relates to bothersome tinnitus serve as a clear visual representation of this intricate connection between patients' thoughts, feelings, and behaviors, and their influence on tinnitus symptoms.
Yeah, so you're kind of saying like a patient's perception of tinnitus really kind of shapes or influences their emotional and behavioral reactions to it.
Exactly it.
Now, in your practice or in your experience, what are some of the common maybe questions and concerns that you hear from patients, and maybe how you go about addressing them?
Patients often inquire about the severity of their tinnitus, wondering if it signals a more serious condition, like a brain tumor. So offering lots of reassurance and explaining that tinnitus itself is not typically a sign of such condition and is rather associated with common health conditions or issues like the one you just mentioned.
Hearing loss, noise exposure.
Yeah. Another common concern revolves around whether tinnitus will worsen over time. Once again, offering reassurance and clarifying that tinnitus generally tends to remain stable rather than drastically changing. And I like to take this opportunity with patients to explain that tinnitus often develops from these unmanaged health conditions, such as untreated hearing loss or
underlying stuff,
unsafe exposure to loud noise, risky listening behaviors with music, untreated hypertension. So addressing and treating these underlying conditions, like you just said, is probably the most effective way to prevent worsening of tinnitus symptoms. Another prevalent concern relates to the inability to enjoy moments of silence and peace due to tinnitus. Right? The best way to address that concern often is just emphasizing on the wide range of sound therapy and sound enrichment devices currently available that can be quite effective at improving the quality of these moments despite the ongoing presence of tinnitus. Now, concern about tinnitus leading to hearing and communication difficulties are best addressed by explaining the difference between tinnitus and hearing loss and highlighting or emphasizing the need for hearing aids or cochlear implant intervention. Concern about tinnitus leading to increased level of stress, diminished concentration, reduced work performance, and just like overall decline in well-being is best addressed by discussing better coping strategies. So encouraging patients to learn relaxation technique or engage in regular physical activity or practicing any form of meditation is great. Also discouraging patients from relying on maladaptive coping strategies like the safety-seeking behaviors we discussed previously Remember those, chronically monitoring the sound of your tinnitus 24/7 or overusing hearing protection devices. Now, finally, like we discussed in episode 3, concern about tinnitus leading to sleeping problems will surely come up.
For sure. How do you go about addressing that one?
So I think the best way to address that is to discuss common factors contributing to sleep disturbances, often linked to tinnitus. For instance, I like to explain that tinnitus tends to be more noticeable and intrusive in quiet environments, like the bedroom. When tinnitus becomes more prominent, it often triggers a stress response, making it even more challenging to both fall or remain asleep. Also offer practical advice on how to improve sleep quality and managing reactions to tinnitus in the bedroom. So those include establishing a consistent sleep routine, reducing intake of stimulants like nicotine and caffeine, and avoiding heavy meals before bedtime, minimizing screen time on phones and laptops for about an hour before going to bed, and incorporating sound enrichment devices in the bedrooms. So these devices, such as a smart speaker, sleep phones or ear pajamas or pillow speakers, can stream sounds of nature or calming sounds or music through their phone and tablets app and help creating a more soothing sleep environment.
So really what you're saying here is that providing reassurance to the patient, maybe and information over and above everything is important in this discussion.
Absolutely. Listening with empathy, offering lots and lots of reassurance, and providing a sense of hope is key here. We said that counseling involves many aspects. Another key one is providing patients with the emotional support they need for embracing change and accepting their conditions. Now, after answering all these questions and addressing all these concerns, clinicians want to articulate or provide patients with a clear and easy to understand explanation of what tinnitus entails.
Got it. So, how do you in particular, how do you go about explaining tinnitus in a clear and accessible way?
Well, let me answer the question by asking you
Sure.
to provide that explanation. And if you wouldn't mind using the central gain model, we briefly discussed in episode 1.
Okay, from what I know, we're dealing with damage in the ear. The damage in the ear reduces the strength or the amount of neural input reaching the auditory center in the brain. And when the auditory center in the brain isn't getting the input from the ears that it's used to, it becomes overactive. It tries to compensate. And this increased neural activity leads to the perception of sound, which is tinnitus.
It's a great explanation, right? Especially for fellow hearing care professionals. But for our patients, we might lose them at neural activity.
Good point.
So to enhance our counseling approach or efforts, it's imperative to simplify our explanations. And the way to do this is by avoiding medical jargon and overly technical terms, and rather using familiar words and analogies.
Okay, so I see where you're going with this. So how would you define or explain tinnitus to a patient?
I would say something along the line that tinnitus often occurs when an individual's hearing isn't as sharp as it once was. So in an effort to compensate for the missing sounds, the brain becomes more active. And this increased activity or effort can be perceived or interpreted as noise. This is similar to a car's engine growing louder when it accelerates, right? A car's engine that works harder becomes louder. So the ringing, the buzzing, the hissing one hears is the brain's way of indicating that it's putting in extra effort to fill in the gaps left by the sounds it used to hear.
Amazing. I love that car analogy. I think it's understandable, and I think people are a lot more likely to remember it Now, how would you adapt the explanation for a patient who has normal pure tone thresholds on their audiogram?
For these patients, I would explain that sometimes the ear damage or the changes in hearing is so subtle that it doesn't show up on an audiogram. A new study published last week, I believe, by the Massachusetts Eye and Ear Institute, indicate that 1 in 10 adults who reported tinnitus also experience auditory nerve loss that wasn't picked up by standard hearing tests. Then I would use a similar explanation for them. I would say that the brain becomes more active because of the absence of certain sounds. So you want to simplify your explanations at all times and emphasize the key connection between tinnitus and hearing, even with minor shifts of hearing. Now, another reason for simplifying our explanations is rooted in research evidence, indicating that anxiety, high stress, and emotional distress can substantially diminish an individual's ability or capacity to grasp or understand health information. Now, we discussed previously that tinnitus patients are more prone to anxiety and high stress and emotional distress. So the need to provide them with clear and easy to understand explanation is even more significant and critical.
And my last question for today, are there any other additional topics or strategies that you use when counseling tinnitus patients?
Yes, clinicians should try to focus on normalizing the tinnitus experience by acknowledging the high prevalence of the condition in Canada at least. So sometimes I'd like to introduce them to the Canadian Health Reports on tinnitus, as the one we discussed in episode 1. Sharing these epidemiological data, that information is enough to alleviate many of these patients from these feelings of isolations. Also, I like sharing success stories from patients who found ways to alleviate their tinnitus symptoms, as they can be quite inspiring, encouraging, and comforting for many, many patients.
Very good. Awesome.
Yeah.
Well, thank you for the great discussion today, Dany. I welcome our viewers and listeners, or I should say, I thank our viewers and listeners for joining us today, and we look forward to your attendance at our next podcast on tinnitus. Thanks again.